I'm Catherine Mukes, licensed professional counselor.
Hi, I'm Dr. B, pediatric neuropsychologist.
And welcome to Let's Talk. So today we wanted to talk with you guys about understanding and paying attention to learning challenges amongst our children. And so Dr. B is the pediatric neuropsychologist, so she's going to take the lead on this one here. So talk to us a little bit about what you experience or see when it comes to learning challenges amongst children.
Well, there are a number of learning challenges. Some we call specific learning disorders. Some are things like ADHD or attention deficit hyperactivity disorder that can occur within children and adolescents. Some of the more kind of common disorders that we talk about are dyslexia, or which is a type of reading difficulty. There are a number of other reading disorders that a child or adolescent may have. A child or adolescent may have a type of disorder called dyscalculia. That is just a fancy term to talk about math-related disorders. There are disorders of written expression. So that is a way to talk about challenges with writing, spelling, grammar, punctuation. And then another one, which is not a specific learning disorder, but it is a very common disorder, is ADHD. And the reason that we're going to be talking about this today is not to kind of give you all an entire book about the specifics of these disorders, but to talk about the importance of recognizing learning challenges, recognizing how they might affect behavioral or emotional functioning, or in turn how emotional or behavioral functioning can affect learning in the school environment or elsewhere. So there are also things like children who experience challenges with motor functioning that can also impact their functioning in the learning environment. So with those types of challenges or disorders that can take place in children and adolescents, experiencing those types of challenges in school can certainly be detrimental to the emotional and behavioral functioning. For example, if I'm having challenges with reading, and reading is such a huge part of what is done in the school environment, then that can wear on my emotional functioning. I can feel pretty tired at the end of the day. I may not want to do too many things at the end of the day, or I may just be feeling down about myself.
And the other piece of that could be when we think about if a child is dealing with an unrecognized, because I think the key is for, what you do a lot of is helping parents to identify and recognize if there is a specific learning disorder there. And so let's just imagine you're a child who's dealing with dyslexia, and so it's not so much that you don't want to read, it's that you're struggling with it, and no one's taking the time to make sure that you have what you need. And so what you may start doing is acting out. You might go, during reading time, and maybe not at a conscious level, but something about you knows that, okay, well, maybe if I push somebody, that'll get me sent to the principal's office, and in the principal's office I don't have to read. I can color until my mom comes and picks me up. And so what I find happening is that if I go, I know it's reading time during this time, and so I'm jabbing my partner, the person next to me, I get in trouble. Well, guess what? It's not that I'm a behavior problem, but because I can't do this, because this dyslexia is in the way, then I may find myself acting out in ways because I don't have the words as a child to say, I'm having troubles with reading. It just comes out as, I don't like it, I don't want to do it, and so I may do things to get me out of that situation, which ends up being taken as a behavioral problem.
Exactly. I mean, you explained that perfectly well. And we've talked about how learning challenges like dyslexia or any other learning challenge could affect behavioral functioning or could affect emotional functioning. But I also want to flip this thing around and talk about how emotional or behavioral challenges or difficulties can impact learning.
Absolutely. And so you may have a situation, because we'll use depression as an example, because depression in children often looks very different than what we're accustomed to, what it looks like as an adult. And so certain behaviors may change. There may be some irritability, or some of the symptoms may be the same. So maybe they're having trouble sleeping, for example. So let's say Johnny lost his grandma, and he and his grandma were really close. And nobody's talking about it. Everybody in the family's going, okay, well, grandma's gone. We need to go ahead and move on with our life. But Johnny's not able to process through those things. And so Johnny may be having nightmares, or he's having trouble falling asleep, which may be over an extended period of time. And so maybe it's looking like, okay, we're moving from kind of normal grief into some depression, because it's starting to interfere with his functioning. So you fast forward, Johnny goes to school the next day, and maybe he's falling asleep in class, or he's not able to focus or pay attention. And it may not be because he has ADHD. It may be because he's dealing with depressive symptoms, and again doesn't have the language to be able to express that. And so that's just an example of how that may show up in our children, and we think that it's just a learning issue happening, but it's really something more emotional happening with them.
Exactly. Another perfectly explained example. And it's also possible that these that the behavioral, emotional functioning and learning challenges can be comorbid, meaning that you can have both. You can have a child who has a learning disorder but who also experiences anxiety. Really what's needed is the assistance of a mental health provider or some type of educational diagnostician to help tease apart learning disabilities versus things like anxiety. Typically a psychological provider would be able to tease apart those things, and it's very important because it's going to impact treatment and impact intervention. So
Absolutely.
you don't want to treat someone for anxiety when they in fact have a learning disability.
Absolutely.
Or and maybe not treat a learning disability because you think that it's predominantly anxiety or depression. So the key point here is we don't expect parents to be able to tell the difference between if their child is experiencing an emotional or behavioral disorder versus a learning disability. We want to encourage you to seek the assistance and evaluation from a mental health provider who has specifically been trained to tease apart these types of questions.
Right. And some of those providers may be available through your child's school. Some schools have school psychologists, licensed specialists in school psychology. LSSP?
Yes.
Okay. Licensed specialists in school psychology. Also pediatric neuropsychologists like Dr. B here, who can do a gamut of testing to determine if it is in fact a learning situation versus an emotional situation. And again, it may be both. And so being able to understand that maybe one has led to the other, or maybe they just both have been there the whole time and we missed it. And so being able to get the adequate assessment first to make sure that's what we're dealing with. So as Dr. B says, that the treatment can be adequate so that our children can function at their highest levels.
So just to recap over what we've talked about today, we've talked about some common learning disabilities or specific learning disorders that related to math, reading and writing, and even ADHD, and how that can affect emotional functioning and kind of result in things that may look like anxiety or may look like depression or some other kind of emotional concern, and in turn how emotional or behavioral concerns, particularly behaviors like acting acting out, or grief or kind of stressors that are taking place in the family can affect the child's ability to demonstrate their optimal or their best performance in the learning environment. And the importance of evaluation and appropriate intervention.
Absolutely.
Absolutely.
So we hope that this video has been helpful for you today. If you have any questions or comments, feel free to drop one in the comments section. Also, don't forget to share our videos, to like us, give us a thumbs up, guys, and let your friends know about it. Hopefully these videos can reach out to someone who really needs this information.
Absolutely.
So we look forward to seeing you next time.
All right. Take care.
Take care. Bye.